Kennel cough, also known as canine infectious tracheobronchitis, is a highly contagious respiratory disease. Dogs commonly contract kennel cough at places where large amounts of canines congregate, such as boarding and daycare facilities, dog parks, training groups, and dog shows. Dogs can spread it to one another through airborne droplets, direct contact, e.g., touching noses, or contaminated surfaces, including water/food bowls. It's highly treatable in most dogs, but can be more severe in puppies younger than 6 months of age and immunocompromised dogs. What are the symptoms of kennel cough? If your dog is affected with kennel cough, you may notice one or more of the following symptoms. Although kennel cough is easily treatable in healthy dogs, Kevin Fitzgerald, DVM, a columnist for AKC Family Dog, explains that it's important to report a coughing symptom to your veterinarian because it could be a sign of a more serious disease. The canine distemper virus and canine influenza virus both start off with symptoms nearly identical to kennel cough, he said. Other conditions that can cause coughing include a collapsing trachea, bronchitis, asthma, and even heart disease. How is kennel cough treated? Typically, mild cases of kennel cough are treated with a week or 2 of rest, but a veterinarian may prescribe antibiotics to prevent a secondary infection and cough medication to ease the symptoms. Nebulizers and vaporizers utilizing inhaled antibiotics or bronchodilators have been reported to be beneficial but are usually not prescribed, Dr. Fitzgerald said. Speak to your veterinarian for treatment recommendations. Also, it's helpful for owners to use a harness rather than a collar to walk a dog with kennel cough because irritation of the tracheal can aggravate the cough and possibly even cause damage to the trachea. If you have a household with multiple pets and one shows signs of a cough, chances are all dogs in the home have been exposed. Can kennel cough be prevented? A vaccine is available for the Bordetella bacterium, which is the most common agent to cause kennel cough. Dogs who are frequently boarded, visit doggy day care, compete in canine sports, or otherwise are exposed to large groups of dogs may benefit from the vaccine, and many training, boarding, and daycare facilities require proof of vaccination. The vaccine is available in oral, intranasal, and injectable forms, and depending on the form, it is usually initially given in 2 doses, 2 to 4 weeks apart, followed by a booster every 6 months to a year. Although most cases of kennel cough are caused by Bordetella, some are caused by other agents, including the bacteria Bordetella bronchoseptica, canine adenovirus type 2, canine parainfluenza virus, canine respiratory coronavirus, and mycoplasmas, so the vaccine may not prevent your dog from catching the disease. If you notice your pet coughing or if you plan to introduce your dog to large groups of animals, speak with your veterinarian. Kennel cough is very contagious, and dogs can readily transmit it by casual contact such as sniffing each other when on a walk, playing, or sharing water dishes. Certain factors increase the likelihood that your dog may contract kennel cough, including stress, cold temperatures, exposure to dust or smoke, and crowded conditions. What is the treatment for infectious tracheobronchitis? There is no specific treatment for the viral infections, but many of the more severe signs are due to bacterial involvement, particularly Bordetella bronchoseptica. Antibiotics are useful against this bacterium. Immunity, even if the dog has experienced a natural infection, is neither solid nor long-lasting. We cannot expect vaccines to do much better. Since immunity varies with the circumstances, consult with your veterinarian regarding specific vaccination recommendations for your pet. Some kennel facilities require a booster vaccination shortly before boarding, and some veterinarians recommend a booster vaccine every 6 months to ensure maximum protection against this troublesome infection. How are the Bordetella vaccines administered? Bordetella vaccination is given either by injection Oral or intranasal route. Intranasal refers to the liquid vaccine administered as nose drops. The oral vaccine is administered directly into the cheek pouch. This allows local immunity to develop on the mucous membranes of the nose, throat, and windpipe where the infectious agents first attack and provides more rapid protection against infection than the injectable vaccine.